when I was in my mid-20s, and I always went to my annual Well Woman exam. And then I was actually given the news that I was having abnormal pap tests, and I really didn't think anything else of it. I continued to go to my annual exams, and basically my doctor told me that the HPV would go away on its own. Unfortunately for me, several years later, it was still there, and it was high-grade dysplasia. So I had a LEAP procedure done, and then 6 months later I had to have a cone biopsy taken of my cervix. Luckily for me, the biopsy came back with clear margins, and ever since then I've had a normal pap smear. I would really want to let other women know that they should continue with their annual Well Woman exam. They should have the HPV co-test as advised by their provider, and they should also, if they're in the certain age limits, they should receive the HPV vaccination. So that's not only for women but for men, boys and girls. Since it is a disease that is sexually transmitted infection, there is a lot of stigma attached to that, and what you can do to help break that stigma down is to share your story with others. And so that's what I've been trying to do in our community in South Carolina. So the sooner we're able to end the HPV stigma, the sooner we'll be able to eradicate cervical cancer.
HPV is the necessary cause of cervical cancer, but it can be associated with other cofactors like immunosuppression or smoking. So when we encourage the HPV vaccine, we're encouraging boys and girls to be vaccinated against human papillomavirus, or HPV, and that is to prevent all of the HPV-related cancers, including cervical cancer, but also vulvar and vaginal cancers in women, penile cancers in men, anal cancers in men and women, and oropharyngeal cancers, most particularly in men, but they do also occur in women. And the HPV vaccine is a non-DNA vaccine. It contains no virus or viral DNA at all. The vaccine is created from a protein coat so that your body learns to recognize essentially the outer coatings or outer trappings of the HPV virus and to kill the virus before it invades the body. The vaccine is recommended for 11 to 12-year-olds as part of a routine adolescent vaccination visit, but can be given anywhere from ages 9 for kids considered at higher risk, all the way up to age 26 for women and age 21 for men. And we encourage anybody in that age range, whether they were vaccinated as an adolescent or a teen or even older, to get vaccinated and protect themselves against these cancers.
Cervical cancer is a fairly infrequent disease now compared to where it was even 20 years ago, but it certainly is a disease of still HPV exposure and unfortunately poor immune response to those viruses.
So cervical cancer is most commonly found by symptoms of pelvic pain or bleeding. Unfortunately, cervical cancer is asymptomatic all the way through the early stages, and if it has symptoms, is not diagnosed until a late stage. So we really, for cervical cancer, encourage women to participate in routine screening because we're looking for that asymptomatic early lesion that hopefully is pre-cancer or early cancer before it becomes symptomatic.
Cervical cancer is really a disease that we primarily treat based upon screening and finding cancers early. If screening is not carried out, cervical cancers are a very dreadful disease and usually found based upon terrible bleeding and pain patterns. It's a pretty miserable disease.
So the treatment of cervical cancer is surgical for early stage disease and includes radiation and chemotherapy for patients with more advanced cancers. Vaginal and vulvar cancers most commonly are caused by HPV, although there's a kind of second type of vaginal and vulvar cancers that are in much older women associated with other kind of chronic skin conditions. But for both of those, we look for any abnormal itching or burning, a lump or a mass that maybe was not there before, and all of those should again be evaluated by a gynecologist. It is very common to see women with kind of persistent itching on one side, not the kind of universal maybe itching, but something that's particularly in one spot that really should be evaluated. And most of these lesions can be diagnosed in a precancerous condition if women are vigilant. Vaginal and vulvar cancers can be really challenging to treat because of the sensitive nature of their location And so the most common, the best way to treat them is surgically, although this can sometimes be a very big surgery that's really hard to undertake and retain a woman's sexual function. And so other courses of treatment for vaginal in particular may include laser or even chemo cream for conditions that are precancerous, which is the most common for vaginal cancers. And for vulvar cancers, really we look at surgery, chemotherapy, and radiation.
After I got married, my husband and I had fun for like a year, and then we tried to get pregnant and just could not get pregnant. We went to see Dr. Schnorr, and when we got in there, he did an ultrasound, and he said, you have a fibroid blocking your uterus 90%. So basically nothing was getting past this fibroid. So they said, we'll go in, we'll scrape out the fibroid, and you should be good to go. So when they went in to cut the fibroid out, my OB was with him, actually, they both did this, and they found a little polyp. They didn't think it was anything at all, they just cut it out to be safe. So when my doctor called, she's like, you need to come in. And I was like, I knew something was wrong. I said, am I gonna die? And she said, not from this. So I got in there, my husband came, and she told me that I had uterine cancer, and that they thought they got it all. And they had no idea it was going to be uterine cancer. I'm the only case like mine in the United States, because when women my age get uterine cancer, they're usually morbidly obese. So they all got together, they went to tumor board at MUSC, and they wanted to try and save my uterus, is what they called it. So they actually put in a Mirena IUD, which keeps cancer cells at bay in a woman, which a lot of people do not know. I didn't know. And so it took about a year for all the cancer to go away. They did a biopsy like every 3 months, a DNZ actually, so they had put me under. And in the summertime when I had my first one, it had come back with hyperplasia, which is precancerous cells. So another 6 months went by, and we had one more biopsy, and it was gone. And so we were 20 days into my diet, and we were about to start the process again, and they came back and told me I needed a donor egg because my eggs were bad. I felt like I needed another biopsy, and I am obviously not one who's like in touch with my body or anything like that. And my fertility nurse was actually didn't want me to. She's like, you just had one. So when I went back and got one, it had come back, and it had come back really aggressively. So I had to have a full hysterectomy, which sent me into surgical menopause. There was really no sign for me at all, would never have known, except really heavy periods, and they just thought it was the fibroids. But it was to the point where like I would have to get in the shower, and it looked like a murder scene. Like my husband didn't know what to do. It was so bad. But now we know that it was probably cancer, but we just attribute it to that huge fibroid. So I think people don't realize how strong they are until they have to be strong, and it's very scary to hear the word cancer. And when I heard it, I immediately jumped to, I'm getting a hysterectomy without knowing the facts. And my other advice to someone is to not get on the internet and Google. That's the one thing that my doctors told me. I have a lot of anxiety, more so before my hysterectomy, but I just listened to them, and I trusted them, and have faith in God. And I don't know, I just went in and I was like, I'm gonna be fine. There is something to be said for having a positive attitude.
So uterine cancer most commonly presents with postmenopausal bleeding. It's most commonly in women who have already gone through menopause, and any bleeding after you've gone through menopause is not normal and should be evaluated by a doctor. I think that's the thing I'd like to convey to women, because we see too commonly that women talk to maybe their girlfriends and say, oh, a spot here or there is not uncommon. So we really want to encourage any woman who has postmenopausal bleeding to be seen by a doctor and evaluated for uterine cancer. In younger women, you can see trouble related to either heavy bleeding or irregular bleeding, or even no periods over a long period of time that can be a heralding sign that something's going wrong. And so all of those women should be evaluated by a gynecologist. Uterine cancer is most commonly treated with surgery. The vast majority, over 85% of women at diagnosis, are stage 1 and simply need a hysterectomy, although some women with higher risk cancers are encouraged to do extra treatment with chemotherapy or radiation to decrease the chances of the cancer returning.
I thought I was one of the healthiest women in Charleston. I don't remember having any symptoms or telling anyone that I had symptoms. I found a bulge under my belly button and went to my general practitioner. She reported it was nothing to worry about, but she recommended that I have it checked and repaired. I thought I was going in for a routine hernia repair. Suspicious tissue was found, and after it was checked and after a scan, the gynecological oncologist reported stage 3C peritoneal ovarian cancer. Within 10 days, I returned to surgery for debulking. After the initial surgery and the 6 chemo treatments, I was elated to learn that the scan revealed no evidence of cancer. And I was cancer-free for 2.5 years. Every day I thought about the symptoms. And of course, every time I had a symptom, I thought the cancer had returned. And it did. My CA-125 blood test increased significantly. Scans revealed a tumor of the liver. They suggested that CyberKnife radiation be used to eradicate this tumor. After I finished those 3 rounds, more chemotherapy treatments were given. And again, I'm grateful to say that I've been cancer-free for 3 years. There were so many side effects during these chemo treatments: nausea, loss of taste, eyes watering, hives, loss of fingernails, and loss of hair. So every 3 months I review the CA-125 blood test with my doctor, and they have been normal since the CyberKnife and the chemo almost 3 years ago. Until a reliable test is developed, early detection is the key to save lives. By listening to your body, by asking more questions, by being your own best advocate, the life you save may be yours.
I was in and out of urgent care. I was in there almost weekly, and they just couldn't figure out what the deal was. And then finally I had enough courage to say, hey, I think I feel a beating in my belly. I said, I know this sounds bizarre, and so of course the first question is, could I be pregnant? And I'm like, no, I had a tubal occlusion, so that is not it. So luckily she took me seriously. I had an x-ray, and it revealed that there's something near my abdomen. She didn't give me much information besides that. After the x-ray, she scheduled me to have an ultrasound done. So the normal ultrasound was done, and a vaginal ultrasound was done. She got that information back, and she told me that I needed to make an appointment with my gynecologist, and she would send the results over. So I go in and I see my gynecologist, and he says, well, you're feeling that beating feeling because you have fibroids, and the way they're positioned near your abdomen is why it feels that way, and you're getting the beating feeling. So he scheduled me a month out to have them removed. Only thing he said is maybe I would look at possibly having a hysterectomy. So I thought, well, hey, that's the worst that could happen. Month later, I go in, I have my surgery. I wake up in recovery with a diagnosis of ovarian cancer. Imagine my surprise. What a blow. So not only did I have a hysterectomy, but I have a cancer diagnosis. So after visiting the gynec, he says, okay, I'm gonna let you recover from surgery before we think about what treatment options are or what are we gonna do. He was a little puzzled because he did not do the surgery. However, he was called while I was in the OR by my gynecologist. So he had a little background information, but not a whole lot. So treatment options were to go in and have another smaller surgery to see whether there was any cells left in, or I could proceed with chemotherapy. I opted to go ahead and do chemotherapy just to be sure that there was nothing left. Did 3 rounds of chemotherapy, and here I am, just a month shy of 6 years.
I have fallopian tube and ovarian cancer, and I am BRCA1 positive. I chose to have the double mastectomy first, because that was kind of the bigger, what I thought would be the more major surgery, and the reconstruction, and that was completely supposed to be preventative. They did find a little bit of cancer there and were able to remove it with the surgery. 10 months later, I got a strange result on a pap smear, and then had ultrasound done, and nothing showed up on that, but had some more tests. I was feeling kind of bloated, and had some more tests, and because I was creating fluid, we went ahead and had the hysterectomy done, and I was stage 3 fallopian tube ovarian cancer. So started treatment. I've had a bunch of surgeries, 3 rounds of chemo so far, and I just started a new drug that was approved by the FDA maybe about a year ago, and so we're all keeping our fingers crossed. My first advice would be, before anything goes wrong, would be to take really, really good care of yourself. I was so lucky. I was in excellent health when all this started. And it sounds kind of funny, but I really was. It was the only thing wrong with me. And I know that makes a huge difference when you have to start treatment. Pay really close attention to your body. Be very aware of it. Take good care of yourself. If something feels wrong, pursue it. Definitely go see your doctor and keep after it.
So symptoms of ovarian cancer can be very widespread and can be very vague. So it could include things like abdominal bloating, abdominal pressure or pain, pelvic pain, urinary symptoms, or GI symptoms like a change in bowel habits. And sometimes patients go to a multitude of different doctors, their primary care doctor, a urologist, a GI doctor, all with the intention of finding out what's causing their symptoms. And we often encourage women, if they have that constellation of symptoms all at once, to see their OBGYN and have a pelvic ultrasound. So ovarian cancer is treated with a combination of chemotherapy and surgery, and with that combination, about 75% of people will get into remission after their first diagnosis. But it varies from patient to patient whether you recommend surgery first, which is most common, versus doing chemotherapy first to shrink the tumor before surgery can be done. One other way to prevent ovarian cancer in particular is to be aware of your family history. So in particular, if you have a significant family history of breast or ovarian cancer, to talk to your doctor about whether you would meet criteria for BRCA testing. BRCA testing currently is only recommended for people considered at very high risk. So for breast cancer, having 2 or more first-degree relatives; for ovarian cancer, having at least 1 first-degree relative with ovarian and another with breast cancer. And so those limitations on the testing really just show that most breast and ovarian cancer is spontaneous. Only 10% are associated with this gene. And yet, for people who test positive, prevention is the key, where we recommend that women actually have their ovaries removed to prevent ovarian cancer, because there's no recommended screening test for ovarian cancer, and the only true prevention is to remove the ovaries. And so for BRCA testing, when we look at the general population, there's not as much data to suggest that every woman should be tested, because the likelihood of a positive test in the absence of a family history of these cancers is really unusual.
You know, all women should have some plan to how to work with their healthcare providers for getting good healthcare, and indications for what you get at different ages really changes as you age. I mean, the younger you are, the less you need. The older you are, the more you need. And certainly, you know, and it changes all the time. I mean, our recommendations on all screening techniques have changed even in the last year or so. Unfortunately, things change pretty frequently. You need to keep up with an up-to-date women's healthcare provider and just follow through the best recommendations you can. And very clearly, screening does save lives. Vaccinations may save lives in the future as well, but at this point it's all about, you know, careful care and screening, attention to symptoms, attention to your own body. There are lots of places for which being your own advocate has to be a big part of this too. You know, we all, you know, struggle with patients who you know, find that they're not getting the care they need, and you just have to really be your own advocate in situations where if you know something's wrong, there's usually something wrong, and it has to just be sorted out.
For cancer prevention in general, we always tell women, stop smoking or don't start. Maintain a healthy weight. Keep an active lifestyle. Those are the things that all of us can do to decrease our cancer risk across the board. In particular for gynecologic cancers, we add to that to vaccinate themselves or their children against HPV, and also to participate in any recommended screening programs. So for example, participating in mammograms or pap smears as recommended by your doctor. And if you have an abnormal pap smear, to make sure to follow that up. And lastly, the things that we talked about, kind of evaluating, knowing your body, watching for symptoms, and going to see your gynecologist in particular for any of these symptoms to avoid, as I was alluding to, those symptoms of ovarian cancer in particular, which can be relatively vague, and maybe a primary care doctor not as vigilant or not thinking about ovarian cancer when you present with abdominal bloating.
You know, genetics testing is an incredibly valuable tool for finding and predicting cancer risk. The problem is it's terribly expensive and you're not going to get it paid for unless you have risk factors, which makes sense. And so once again, you got to look with your healthcare provider and look at what your risk factors are. Certainly anybody who has cancer already or has a personal, you know, relationship to a person with cancer, those patients can be screened usually pretty readily based upon the information that's available. Patients who do not have cancer, screening is not as readily available, but you can look at your own family history and make sense of that. A big part of identifying genetically inspired cancers is awareness within your own families, and particularly here in the Southeast, it was a pretty significant problem that patients didn't talk about what they had, and it's very hard to find what, you know, Aunt Edna had, you know, 20 years ago. Nobody told anybody, and so significant problem with putting together an understanding of where your risks lie is understanding your own family.
For any woman with a cancer diagnosis, I recommend a few things. First, listen to your doctor. They are your best advocate and they want what's best for you. I usually encourage my family members to get a second opinion just to make sure that your doctor is up to date on all the latest information. You want to ask questions about participating in clinical trials to really make sure that you're getting the latest and most available information. So for most people, I would say a second opinion in an NCI designated cancer center or an academic center in your area to really make sure that you have the latest information. And lastly, for women with a cancer diagnosis, to be informed themselves, whether that includes some information at a reputable website like you know, www.cancer.org, the American Cancer Society website, or others, to be informed themselves and come to those appointments prepared with questions. Always bring a family member because they will hear more than you hear. And when you're ready, when you have finished your treatment, to be an advocate, to turn a negative into positive, and just like the women on this video, to tell your story.